All right, now's the time to take a deep breath and relax. We're going to talk about something that may make some of you uncomfortable, colonoscopies. To put it mildly, it's an unpleasant procedure. But new research out today highlights the potentially life-saving benefits of having one. So to look into the findings, we're joined now by CBC medical specialist Dr. Karl Kabasele. I'll try to keep the jokes aside here with colonoscopies, but the colonoscopies have been around for a while. So what is this research saying?
Well, this is just sort of more evidence to support the use of colonoscopies to help people prevent colon cancer. But let me just say that, first of all, there is already good evidence that doing the colonoscopy can reduce your incidence, your chances of getting colon cancer. What this new research is doing is showing that it can reduce your risk of dying from colon cancer, and as much as a 50% reduction in colon cancer death.
Okay, so how conclusive, though, are these findings?
Well, that's the tricky part. So what they did was they gathered people at a particular hospital who had been referred for colonoscopy, and then they sort of studied them. So we're not talking about the general population of people who are at low risk or sort of normal risk. These are people who were brought to the attention of doctors because of some sort of risk for colon cancer. But what this does prove is that it is effective to remove what we call polyps, which are precancerous growths inside the colon. And that's what you do during a colonoscopy. You're going into the colon with a camera. If you see a polyp or a little growth on the surface, the inside surface of the colon, it can be removed while you're doing the screening test.
Is that the only thing that doctors are looking for then during the screening?
Well, you're looking for that. You're looking for any abnormalities, and sometimes, unfortunately, you may see cancer. You may see actual cancerous growth within the colon.
Okay, so what does it mean, those polyps, if they're found? Is that dangerous?
Well, it could be. So not every polyp will become cancer, but there's certain types that will. So what happens is, if there's a polyp seen, it's removed, if possible. It's sent over to the pathology lab, and the pathologist will look at the cells and be able to give an opinion as to whether this particular type of polyp is likely to progress to colon cancer.
Should they all be removed?
Yes, they should definitely all be removed so that there's an opportunity to then look at them under the microscope and let the person know what their risk profile is.
It's a pretty invasive procedure, though, and I was worried. I haven't had one yet, so I didn't know if I should. So who should and when should you do it? How often should you do it?
Well, that's the thing. So in terms of what the evidence shows, we know for sure that screening people for occult blood in the stool, there's a test called fecal occult blood test, FOBT, that your doctor could do in the office. You can actually get a kit and do it at home. What it's doing is taking a sample of stool and adding a chemical to it which shows traces of blood that you wouldn't see in the stool just with your naked eye. That may indicate that something's bleeding in your colon and that something may be cancer. But as far as colonoscopies are concerned, that tends to be a test that's done if there's a reason to do it. So if you're at high risk for colon cancer, if you've had that in the past, if you have a positive family history, if you have symptoms that are consistent with colon cancer, that might be a reason to go for the more invasive but definitive test, the colonoscopy.
No matter what your age or gender?
Well, that's right. So in general, the research that's going on right now is to see, do we need to give colonoscopies to everybody? It's not clear yet. But around the age of 50 is the time when you should start to be screened regularly, sooner if you have risk factors for colon cancer.
All right, appreciate it, Dr. Karl. Thank you.
Thank you.
CBC medical specialist Dr. Karl Kabasele here in Toronto.